Okay, week 6. And our primary focus this week is medication errors. That's about as fundamental as it gets. Um, Ways to avoid medication errors. What are medication errors? Medication errors come from everywhere. The wrong medicine could be prescribed in the first place. Okay, that's more of a medical error than it is a pharmacy error. Um, Pharmacy could not notice that a medical error was made. Or the order could be, this is the classic, the order could be misinterpreted. The pharmacist could read it incorrect. The tech could read it incorrectly, and the pharmacist could look at it and say, yeah, you're right. And you'll find that the root cause of that usually is hurrying. Okay, it's unfortunate, but we get busy and we can get extremely busy sometimes, too busy. And you have to learn when it's time to put the brakes on and be more careful about being sure you're right than being sure that you're fast. It's a temptation. We all want to appear to be efficient and productive at work, and yeah, we need to be efficient and productive at work, but in an effort to demonstrate that, let's be sure that we're not throwing the proverbial baby out in the washboard. That is, throwing the patient's safety out in our attempt to be quick. Okay, so keep that in mind. There are things we need to check. If you're involved in administration of medication, and that's not a traditional role for pharmacy techs, but it's also a role that is being tried experimentally in some hospitals, and they're finding pretty good success with it. So you may find yourself working in a hospital soon where you not only would prepare the medication bins for the patients, but then turn around and give the medication to the patient. Medicine and the way it's practiced is pretty fluid right now, and it's changing. So whatever it is that you're absolutely totally sure that that somebody in your profession will never do is probably something that you'll find yourself doing before you're done. Yeah, maybe not this year, maybe not next year, but like I said, everything in medicine is pretty fluid, as we all make an effort to try to be as efficient in our delivery of healthcare that we possibly can. Okay, all right, so that's that speech. But the important thing is use enough care to be safe. Check what you need to check, and if something doesn't make sense, you can't read it, it doesn't look right to you, ask somebody. And if you can't if you can't agree, if the two of you are not confident that you're seeing what you think you're seeing, then you need to get a hold of the prescriber and make sure that the prescriber lets you know what it is they intended. That seems to be the kind of thing that is easier to do now than it was classically. We used to cringe if we had to call a doctor and possibly correct them, because they would get defensive and get upset and rant and rave. The new training seems to be with younger physicians that, hey, be grateful that somebody is looking over your shoulder and keeping you out of trouble, and respond to them as if you are grateful, because it's for the patient's safety. Okay, so those are the kinds of things we're going to look at. Identify medications clearly, identify patients clearly, Make sure you understand schedules. Make sure you understand roots of administration, and all those sorts of things. It's a pretty straightforward and simple chapter. There's not a ton of information in it, but there's enough to make it a little bit challenging anyway. So I hope you all have a good week and enjoy this chapter and this week. And I'll be seeing you. Okay, thanks.